Good morning. Welcome to Wednesday Web Chats with Therapies of the Rockies. I'm Melanie Wiseman, a speech pathologist and the clinic director. This week on Wednesday Web Chats, we are talking about play-based therapy. It's a hot topic. One of the things sometimes that we hear about, or you might overhear parents saying is, oh, I don't know what the therapist is doing. She's just playing with him. And that is one of the things that we try to combat and discuss so that everybody is understanding what it is that we're doing. Play-based therapy is a thing, it's a type of therapy, and it's evidence-based through research that supports what it is that we're doing. As long as the professional doing the play-based therapy has appropriate targets and has planned it out thoroughly, it is appropriate and useful for helping a child reach their goals. It's important to understand that there are different types of play. There are different stages. So you go from solitary play to parallel play, interactive play, etc. And knowing what stage a child is at is really helpful when understanding what it is that the therapist is working on with them and how to meet their goals. Children need to demonstrate joint attention in order for any goals to be addressed, and so sometimes different types of play skills and teaching children interaction is going to be what precedes targeting those language goals. Play-based therapy is really effective because it gives children the opportunity to play in a natural way and to learn language or speech skills in a natural type of setting. It doesn't always have to be so structured and sitting at the table and drilling, even if it's not a 2-year-old. 5-year-olds can benefit from this too. Children of all ages, you can incorporate speech targets into the things that you're doing, and research actually shows that it makes it more functional and more relatable for them to carry those skills over. So I wanted to just show you a couple of examples of things that we can do that might look like we're just playing, but in fact the therapist or the professional who's doing the play-based therapy actually has some pretty strong targets in mind. One of the things, that's very popular, especially with the little kids, is a little baby doll. There's so many things that you can do. You're teaching play skills for a little one. You're doing things like feeding the baby, putting the baby down for a nap, playing with the baby, taking care of it. Older kids who are working on speech targets, you give the baby a fun name, such as little, baby Sally. You're working on your S sound, and you're giving the baby things to do. Sally sleeps, and you get targets in, and then you play. And then you get a few more targets in, and you keep playing. Sally sews. She's making some fun clothes for her to play with. Things like that. Other things that we have that you can be using in language targets. This is a fun activity from Melissa and Doug. Pizza and sandwich felt activity that the kids just love. Comes with a little tray and all these different pieces that you can build your pizza slices, you can build sandwiches, and right there you're playing with the therapist. It's more natural for the child and they don't feel like they're just doing drill work. You're able to incorporate requesting. You're building vocabulary for things that go with sandwich building, eating, going on a picnic. Some great tasks, you can also be looking at basic concepts such as colors, spatial locations, where you're putting things, and all these things can be targeted in just a play activity without the child realizing that they're working on their speech work. So play-based therapy does not have to have a negative connotation with it. It really is a great resource and a thing for therapists to be doing because it's actually making it more functional and relatable for the children, makes it more fun. And it's a great way for us as a therapist to give parents and caregivers things to do at home. We're able to demonstrate to them, we took a regular fun game or activity and we're going to teach you how you can do it at home and practice your speech and language targets the same way that we do in therapy. So I mentioned, I think last week, that I have found these awesome handouts on the Super Duper website. We have another one here that pertains to play-based therapy. It breaks down the stages that I talked about and different things involved in play-based therapy. Again, if your therapist is planning thoroughly, if you're hitting the targets that your child needs to be working on for building their skills, it's a great resource to utilize. So reading up on that and getting some more information can help you feel more informed and feel better about what is going on. If you'd like a copy of this, let us know because we'd love to send it over to you. And let us know if you have any questions about play-based therapy or things that are going on like that we can address for you, because we would love to talk about them. Thanks for joining us, and make sure you check in next week. Thank you for joining us on Wednesday Web Chats. Have a great day.